Hello everyone! Welcome to the EasyMed channel. In this video, I am going to talk about semaglutide. Semaglutide is one of the widely prescribed medications, and it is available under two brand names, Ozempic and Wegovy. It is one of the GLP-1 receptor agonists that has two advantages over endogenous glucagon-like peptides. It has a few modifications in peptide structure that make this medication stable towards the degradation enzyme DPP-4, dipeptidyl peptidase 4. It also renders this compound long-acting. Before we talk about how semaglutide works, let's talk about the role of GLP-1 in our body. Ingestion of food stimulates the release of incretin peptides, like GLP-1. This mediator has several roles in the body, affecting various organs. It can act on the brain to control the appetite centers, which results in reduced food intake. Another important action is on the pancreas, where it can stimulate the release of insulin while inhibiting glucagon release. Both of these actions result in the regulation of blood glucose. It also reduces GI motility, which reduces glucose absorption. Finally, it also reduces hepatic glucose production. However, the role of GLP-1 is limited due to its degradation by the DPP-4 enzyme. This metabolic enzyme removes two terminal amino acids, rendering this mediator inactive. Now, semaglutide has modifications in its peptide structure such that it cannot be cleaved by the DPP-4 enzyme. With such stability, along with its long duration of action, semaglutide can better control glucose levels and appetite in people who are overweight. So, today in this video, let's explore semaglutide, how to take this medication, how it works, and what to avoid while taking this medication. We will also discuss common and important adverse effects that can be produced by this drug. Please don't forget to subscribe to this channel, and please click the bell icon to get more updates from this channel. If you really enjoy watching this video, don't forget to hit the like button and share it with your friends. So let's start our discussion with how this medication works. As we have discussed earlier, the effects of semaglutide are mainly attributed to its action on the three organs. It acts on the brain to control appetite, it acts on the pancreas to release insulin and inhibit glucagon secretion. It also causes a delay in gastric emptying. All these actions are due to this agonistic activity on GLP receptors. For instance, in beta cells of the pancreas, GLP-1 receptors are expressed, which are G-protein coupled receptors. When semaglutide binds to these receptors, they are activated, resulting in stimulation of the adenylyl cyclase system. This intracellular enzyme converts ATP into cyclic AMP, which then stimulates protein kinase A. This is a phosphorylating enzyme that controls the activity of many ion channels and enzymes. One of its targets is the ATP-sensitive potassium channels, which are closed, resulting in no movement of potassium outside of the membrane. Similarly, it can activate voltage-dependent calcium channels that bring more calcium into the cells, leading to depolarization. Another target is EPAC2, which is directly activated by cyclic AMP. On activation, they interact with endoplasmic reticulum, which results in more calcium release into the cytoplasm. All these actions bring positive potential to the membrane, leading to the release of insulin by exocytosis. Now let's see how to take semaglutide. Semaglutide is available as a subcutaneous injection in pre-filled pens. Under the brand name Ozempic, it is useful for the treatment of diabetes mellitus. Each pre-filled pen contains 4 doses. They are divided into equal doses and can be administered over 4 weeks. For the treatment of diabetes, initially it is started at a dose of 0.25 milligrams, given every week. Therefore, the pre-filled pen delivers 4 doses of 0.25 milligrams every week. After 4 weeks of treatment, the dose can be further increased to 0.5 milligrams, so that now the pre-filled pen delivers 4 equal doses of 0.5 milligrams every week. Further dose increments may be made if sufficient glycemic control is not achieved after at least 4 weeks of treatment. This time, the dose may be increased to 1 milligram given every week. The site of injection is variable, and it can be given to the abdomen, thigh, or upper arm. This medication can be given either with or without a meal during the day. Even the day of administration is adjustable, if needed. Generally, the gap between 2 consecutive doses is maintained at 7 days. So if the first dose is given on Monday, then the next dose is given on Monday of next week. However, the gap may be altered in the event of a missed dose. In such situations, the missed dose can be administered at the earliest possible time on any day of the week, maintaining at least a 3-day gap for the next dose. For instance, if a dose is missed on Monday, it can be given on or before Friday of the same week, so that the next dose can be administered on Monday of next week. Pre-filled pens are also available for the treatment of obesity under the brand name Wegovy. Again, each pre-filled pen contains 4 equal doses, and therapy is started at an initial dose of 0.25 mg given every week. Dose increments can be done after 4 weeks of treatment, and the maximum dose is 2.4 mg per week. Semaglutide is also available as an oral tablet under the brand name Rybelsus and is again indicated for diabetes. It can be started at an initial dose of 1 mg. Unlike subcutaneous injections, semaglutide tablets should be given at least 30 minutes before meals, particularly the first food intake of the day. Tablets should be taken with 4 ounces of plain water. After 30 days of treatment, dose increments can be done to a dose of 7 mg. The maximum dose is 14 mg, which can be given if more glycemic control is needed. Now let's see the precautions for semaglutide. As semaglutide acts on the pancreas and activates GLP-1 receptors, it also shows its adverse effects on this organ. It may develop pancreatitis in people during therapy. Therefore, the development of symptoms like severe abdominal pain and vomiting may indicate the incidence of pancreatitis. At higher doses of semaglutide subcutaneous injection, above 0.5 mg, a significant hypoglycemia may be produced. When semaglutide is combined with insulin preparations, the reduction in blood glucose levels is further increased, leading to severe hypoglycemia. Therefore, symptoms like sweating, dizziness, lightheadedness, shakiness, and a rapid heartbeat may warn of the incidence of hypoglycemia in people. This may further increase the risk of diabetic retinopathy, as hypoglycemia may result in low oxygen supply to the organs. Therefore, for people with any history of diabetic retinopathy, semaglutide should be carefully used. Another effect of semaglutide is observed on the kidney. Use of this medication may result in acute kidney failure that may lead to the induction of vomiting and diarrhea in people. On long-term use, semaglutide may precipitate gallstones. Hypersensitive reactions like anaphylaxis and angioedema may be observed. Semaglutide has significant effects on the thyroid gland when used in long-term therapy at higher doses. In the C cells of the thyroid, calcitonin is generally released in a controlled way. However, semaglutide can induce thyroid C cell tumors, resulting in elevated levels of calcitonin greater than 50 nanograms per liter. Therefore, medullary thyroid carcinoma is a black box warning with the use of semaglutide. Now let's see the adverse effects of semaglutide. Common adverse effects mainly include diarrhea, nausea and vomiting, abdominal pain, and dyspepsia. Other side effects like dizziness, headache, nasopharyngitis, and hypoglycemia are also observed. So that's all about the pharmacology of semaglutide. Thanks for watching this video. Please don't forget to subscribe and hit the like button. Stay tuned for another interesting video with a new topic. Have a nice day, take care, goodbye.